Thanks for the opportunity to present today. My name's Alexandra Littlewood and I'm a Critical Care Junior Clinical Fellow at Queen's Square. Together with my supervisor, Dr. Yasmine Samaroo, I completed a closed-loop audit of the compliance of our hospital's preoperative cardiac investigations against GIRFT guidance. Preoperative investigations should follow evidence-based guidance to avoid unnecessary testing as well as possible delays to surgery. A local service evaluation I completed at our hospital found that echocardiogram requests in our pre-assessment clinic were associated with prolonged surgical timelines, with surgical delays ranging up to 23 weeks in duration. We completed an initial audit in July to August 2025 of the compliance of our consultant-led preoperative assessment clinic against the NHS Getting It Right the First Time, GIRFT, Guide to Preoperative Testing for NT-proBNP and Transthoracic Echocardiography. 74 patients were reviewed over a 2-month period, with a 78% compliance with GIRFT guidance. These 74 patients resulted in 14 echocardiogram requests, of which almost half were not indicated according to GIRFT guidance. Following this audit, we implemented targeted staff education on the GIRFT guide. This current project aims to complete the audit cycle by evaluating compliance with GIRFT guidance for NT-proBNP testing and transthoracic echocardiography in our consultant-led preoperative assessment clinic following targeted staff education. The project is a single-centre retrospective audit and reviewed all patients attending our PAC clinic during a 2-month period between March and May this year. Data was collected from electronic patient records, including medical history, PAC assessment, investigation requests, and investigation results. 90 patients were reviewed during the study period, with 90% compliance with GIRFT guidance compared with 78% in the initial audit. There was an increase in NT-proBNP testing in the re-audit period from 45% to 59%, alongside a reduction in echocardiogram requests from 19% to 7%. All echocardiograms requested in the re-audit were aligned with GIRFT guidance, compared with just 57% in the initial audit. In summary, this closed-loop audit found that staff education was associated with improved compliance with GIRFT guidance. And of particular note, all the echocardiogram requests in the re-audit period were aligned with GIRFT recommendations. This is important because preoperative echocardiograms are more resource-intensive than NT-proBNP blood tests and have previously been found to be associated with prolonged surgical timelines at our hospital.